Welcome to another edition of Muscle Research Review for the week of February the 16th. Quick research summaries for the very busy health and fitness professional. So let's begin. The battle between static stretching and contract relax stretching continues with a new study. We've previously talked about P&F techniques providing more joint stability than static stretching. Let's take a look at the results of a new study. The new study looked at the acute effects of contract relax stretching versus static stretching on strength loss and the length-tension relationship. They measured 20 healthy people at 4 different knee angles, before and after stretching. The result? Surprisingly, there was no difference in length-tension relationship. More surprisingly was the greater strength loss of the contract-relax group. They actually recommended static stretching for the hamstrings. Now, putting it into practice, it seems stretching may better be saved for post-workout, especially when the body has been warmed up. Prior stretching, no matter what kind, can lead to strength losses. What's your stretching strategy? Leave a comment below. Do adolescent patients recover adequate functional movements after primary ACL reconstruction? A new study compared a series of 39 adolescent patients with a mean age of 13 to 16 to 16 adults with a mean age of 27. The groups were compared 9 months post-surgery through the functional movement screen for movement competency and the lower quarter Y balance test for single leg length dynamic balance. There was no difference for the single limb dynamic balance between the groups. However, the adolescents demonstrated wider ranges of anterior reach asymmetry, indicating increased risk of injury. Putting into practice, you may want to address functional movement deficits in adolescents more closely before return to sport. Do you have any other factors you look at when it comes to adolescents? Let me know your thoughts. Do your patients or clients report low back pain from prolonged standing? This new study may provide you with some extra advice for them. The study looked to see the relationship between lumbar lordosis and low back pain intensity while standing. The group performed light work while standing for 2 hours. 24 were pain developers and 33 were not. The study found that in pain developers, lumbar lordosis was significantly greater, suggesting that more lumbar lordosis can be a risk factor for low back pain during prolonged periods of standing. Developing a standing posture for your patients and clients that reduce lumbar lordosis may have a positive effect. I also look forward to seeing studies that put this into practice to see if it actually does work. So you see someone with patellofemoral pain syndrome. Ever wonder what factors can predict better response to exercise? Apart from a crystal ball, this new study did an explorative analysis of a randomized controlled trial. Here's what they found. They looked at function and pain on activity at 3 months follow-up to exercise therapy. They found 2 factors that have a predictable value. 1, higher function scores were seen in the exercise group versus the usual care group for females with patellofemoral pain syndrome compared to males. 2, there was higher functional scores and less pain on activity for those with a duration of complaints greater than 6 months compared to usual care. However, a study in 2010 found that the longer duration of symptoms led to a poorer outcome in treatment regardless of gender or age. The treatment for that study was about 6 weeks of multimodal physiotherapy. Want a comprehensive list of factors that predict patellofemoral pain syndrome? Check out the sportsphysiotherapy.com. They have a great article on other factors. The link is provided below on our YouTube channel. We finish off with another study looking at patellofemoral pain syndrome. More specifically, the study answered the question, does eccentric hip abduction strength reduce the risk of developing patellofemoral pain syndrome in novice runners initiating a self-structured running program? Now, the recent research shows that gluteal weakness is associated with patellofemoral pain. This study looked at 832 runners at baseline, and 629 were included in the final analysis after 1 year. They grouped initial eccentric strength as high, normal, and low strength. They found that initial high eccentric hip abduction strength reduces the risk of patellofemoral pain. Now, putting this into practice, a good program of increasing eccentric hip abduction strength can go a long way in prevention in using a prevention program for patellofemoral pain syndrome. If you're looking for the best exercises for gluteus maximus and medius, check out the link to an article by Mike Reinhold. It's a short but great read. Again, link is provided on our YouTube channel. If you have any comments, please leave them below. Again, to continue staying up to date on the latest research findings, subscribe to our YouTube channel. Until next time, this is Dr. Jasper for Muscle Research Review.